Good evening and welcome, everyone. My name is Anna Marie Golden. I'm Director of Community Relations at Baystate Health. On behalf of Baystate, I'd like to thank you for taking time to join us this evening for our COVID vaccine town hall. It is my pleasure to serve as your host and moderator. Baystate is hosting tonight's town hall because we understand that many in our community, especially our Black and Brown communities, have questions and concerns about COVID and the various vaccines. Our goal this evening is to provide you science and fact-based information and answer your questions to the best of our ability so you can make an informed decision for you and your loved ones. First, a few housekeeping items to ensure that everyone's participation goes smoothly. We do have participants joining us this evening via Zoom, by phone, and others who are streaming via Facebook or YouTube. Please note we are also recording this town hall, so it will be available for on-demand viewing on Baystate's YouTube channel. Closed captions are also available and will be automatically streamed to our participants joining by Facebook and YouTube. For those joining us via Zoom, to turn on the closed captions, please click the closed captions icon in the bottom of your screen. I'd like to take a moment to offer my appreciation to Baystate's marketing and communications team, Baystate's translation services, our presenter, Dr. Durain Walker, and finally, our community partner, Focus Springfield, for their invaluable technical expertise in producing tonight's event. We will be hearing momentarily from Dr. Walker. Following his presentation, I will open the program for questions and answers. For those joining us via Zoom, please look to the bottom middle of your screen where you will see the Q&A icon. If you would like to ask a question during the Q&A, please submit your question via the Q&A icon. I will read the first name of the person submitting and the question in the order they are received. If you would like to remain anonymous, you may check anonymous when submitting your question. We have also invited the community to submit questions in advance. As time allows, these questions will be incorporated into the Q&A portion. It is now my pleasure to introduce you to our presenter. We are joined this evening by Dr. Durain Walker. Dr. Walker obtained his medical degree in 2002 from the University of West Indies in Jamaica, where he is from, and worked as an attending physician for 6 years before moving to New York City, where he completed his internal medicine residency training at Mount Sinai Hospital, Queens Hospital Center in 2011. He then did his infectious disease fellowship training here at Baystate Medical Center in 2013. He is double boarded in internal medicine and infectious disease. Dr. Walker, I'm happy to turn the program over to you at this time.
Thank you, Anna Marie. Okay. So welcome. My name is Durain Walker, as you heard earlier, and I'm here to talk to you today about the COVID vaccine. I'm hoping that after this presentation, I'll get at least 1, 2, 3, 10, 100 persons vaccinated if they weren't before this presentation. So just a couple of housekeeping things. The COVID pandemic has been fast changing. So just like everything else, what I present today is up to date as of a few hours ago, but things may change by tomorrow or next week. So we're trying to keep with the times as much as possible. So just a note on that. So,
Dr. Walker, we can't see your screen. I'm not sure if you're sharing it yet.
Oh, let's see. Sorry, is it?
There we go.
Perfect.
Good to go. Thank you.
Sorry about that. Right. So like I'm saying, this pandemic has been ever changing. So we want to make sure that we are on top of the data as it emerges. So let's talk a bit about the coronavirus. What is coronavirus? We've heard this term over and over again, and corona really comes from the term, the Latin term that means crown. And if you look on the picture on the screen, there's some of the red dots. Those are the crowns on top of the particular virus that gives it its name, coronavirus. It's a zoonotic disease. That means it can be passed from animals to people, which is how most viruses can spread. And there are 4 different subgroups of this particular virus: alpha, beta, gamma, and delta coronavirus. It was first discovered in the 1960s. And since then, there have been 3 ones of importance. First is in 2003, we had a SARS outbreak, severe acute respiratory syndrome, that was caused by SARS coronavirus, and that was first found in China. In 2012, there was a Middle East respiratory virus called MERS. That was also a coronavirus, and that was first found in Saudi Arabia. And fast forward to 2019, now we have COVID-19 from the SARS-CoV-2 virus. Now, let's look at these 3 different viruses. So the reservoir for SARS-CoV-2 is thought to be probably a bat. And when these bats come into contact with other animals, these animals can then pick up the virus and then transmit it to humans. Also, when humans encroach on the habitat of bats, sometimes they may be directly infected if they're exposed to these bats. So these are some theories, we think, how the virus has spread to human beings. There are other forms of coronavirus out there that are not as deadly as coronavirus, and these we have in nature all over. Now I'll pause here for some questions that we have here, just to see how much you guys know.
Brandon, are you able to pull up the poll questions? Here we go.
So the first question: the COVID-19 coronavirus is expected to mutate, true or false? I'll just let you answer the question, and then we'll see what the results are at the end. The second question is, Black and brown persons have had more infections, hospitalizations, and deaths from COVID-19 compared to our white counterparts. Is this true or false? The third question is, you can stop wearing a mask in public after you've been fully vaccinated. True or false? And the final question is, the COVID-19 vaccine did not undergo the same steps as other vaccines have. True or false?
We'll give it another 30 seconds for folks to respond, and then we'll see the results.
Okay. Okay, wow. Okay, very smart group, I like it. All right, so great, let's continue. Hopefully at the end of the discussion, you'll be able to get the questions 100% correct. So moving on. Are we still, oh, there we go. So let's look at COVID by number. So we've had over 149.8 million of the cases confirmed now in the world, about 3.1 million deaths. And in the US, we've had 32 million cases, and almost 600,000 deaths we're fast approaching. If you look at the graph here, this spike here is India. India is having a very bad third wave right now. But the US, which is this graph here, is coming down nicely because of our vaccine efforts. This graph just shows a plot of the countries that are the 10 hotbeds now for the coronavirus. And we're doing quite well, as you can see from the graph. If you look at this particular graph box here, it's looking at the cases, hospitalizations, and deaths from COVID amongst white persons compared to non-white persons. So if you look here, the as compared to white persons, African Americans have 1.1 more cases than COVID, and brown persons, Hispanic and Latino persons have twice the amount of cases as compared to white friends from the coronavirus. If you look at hospitalizations, American Indians have 3.5 times more cases being hospitalized. Blacks have 2.8 times more, and brown persons have 3 times more cases of hospitalizations than persons who are white. And if you look at deaths, in African Americans, about 1.9 times more, and 2.3 times more in persons who are Hispanic, and 2.4 times more for American Indians. So Black and brown persons are at a disadvantage in terms of deaths and cases and hospitalizations. If you look at Springfield proper, this is just a distribution of the amount of cases that we have per percentage. For the white population, is about 32% of the cases are amongst white persons. Amongst Black individuals, it's about 19%, and about white Hispanics and other Hispanics is about 40%. So that's our local data that we have for Springfield. Now, this COVID pandemic has taught us so much as physicians and clinicians. It affects practically every system in the body, right? It can cause fatigue, mental fog, cough, joint pains, and not everybody who gets infected have the same symptoms, as you probably have heard, because we all know somebody or 2 or 10 who's had COVID before, and they don't all experience the same symptoms. They can affect your heart, your kidneys, your skin. Some persons have complained of a brain fog after they've been diagnosed with chronic cough or joint pains. This affects their mood, their taste, their smell. So it's a horrible disease. So it affects many organ systems. Now, how can we prevent the infection? Vaccines, right? So what is a vaccine? Basically, a vaccine is a biological preparation that provides active acquired immunity against a particular infectious agent. So, for instance, you take this vaccine, the vaccine via a pill, which can be like for the typhoid vaccine, a drop, such as a polio vaccine, or an injection, such as the COVID-19 vaccine. And vaccines are prepared in many different ways. Some vaccines, but they all have one thing in common. They have an agent of the pathogen you want to vaccinate the person against in a killed form, or a part of the particular bacterial virus being used for the vaccine, or you can use its surface proteins of the particular virus to make the vaccine, which is the case with COVID-19 vaccine. Now, let's look at the steps involved in how vaccines are developed. On the lower part of the screen, you'll see that vaccine takes a long time for a vaccine to be developed. From conception, you have to do the research, initial development, testing to see if the vaccine is safe, to get the right dose. And then after it's been tested and found to be safe, you need to get approval for the vaccine, and then you have to start making it and then delivering it to the site for us to get the vaccine. For the COVID vaccine, every single step was followed, except we had some 2 steps that were being done at the same time. So when we started to test the vaccine earlier last year, we also started to make the vaccine, because these were very, very difficult circumstances. We wanted to make sure that if these vaccines are found to be effective, we can get them out to the right place, to the right persons as soon as possible. So this particular step of manufacturing happened just after they started to test the vaccine. Then we sought FDA approval, and then it's delivered to us. So no step was skipped at all when the vaccine was being prepared. So you may hear this out there, it's not true. Every single step was followed, but some steps had some overlap because these were very, very, very dire circumstances. So far in the US, we have 3 different vaccines approved. Well, for EUA, the Pfizer vaccine, Mrna Vaccine, and the J&J vaccine. These are the three that we have approved in the US. This is just a schematic that compares the three different vaccines. Pfizer and Moderna are two-shot vaccines. For Pfizer, the second shot is given after 3 weeks. For the other one is given after 4 weeks. The J&J vaccine is a single-shot vaccine. The J&J vaccine can be stored in a regular fridge, and the Pfizer and Moderna are kept at much colder temperatures. The Pfizer and Moderna are what are called mRNA vaccines, and the J&J vaccine is not an mRNA vaccine. We'll talk about that later on. Can these affect your genes? No, they cannot. The Pfizer vaccine is approved for persons above the age of 16. The other two are for above the age of 18. In terms of effectivity, so effectivity is the way a vaccine can prevent you from getting symptoms from a particular infection. So for Pfizer and Moderna, they're comparable at about 94%. For the J&J vaccine, it's about 66% to prevent you from getting symptoms. However, in the J&J vaccine trial, they looked at the amount of how effective the vaccine was to prevent you from being hospitalized from COVID, and that jumped up to 94%. It's still a very effective vaccine to prevent you from being hospitalized, even if you do acquire COVID. So they're all very effective vaccines. And the common side effects are universal: pain, whatever, joint pains, fever. We'll talk about that in the next couple of slides. Now, let's spend some time on this particular graphic here, because this is really, really cool stuff, okay? This like literally blew our minds when we learned about this. So this is how the vaccine are created for the Pfizer and the Moderna vaccine. These are mRNA vaccines, right? So what they did is they took the little crown, the spike protein. They found a way to get the code, how to make this spike protein, and put that code in an mRNA sequence, which is the messenger. It literally means messenger RNA. So this messenger is incorporated in a lipid coating to make it more stable. And then you get the jab on your arm, and this lipid coated thing gets into your arms. Once it gets into your arms, the cell binds to your cells and dump the mRNA into the cell. The mRNA is a message that tells the cell, hey, make some spike protein. So the cell starts to churn out spike proteins, and then the messenger, the mRNA part, is completely destroyed and tossed out by the body. So it doesn't link on your body, doesn't affect your DNA. Once the spike proteins are made, they're put on the top of the cell, and then the cell presents these spike proteins to the body and say, hey, I'm here. The body starts to attack these particular spike proteins, and now you get the fevers, you get the chills, you get the shakes. The vaccines is working and doing its job. That's what you want to happen. So that's the mRNA vaccine. The other vaccine, the J&J vaccine, is a slightly different vaccine, and it's made using a viral vector. So what a viral vector is, it's a cold virus that is, they've taken out its DNA to make it weak. It cannot come into your body and replicate. It's just a very boring, dead virus. So what they've done is put the DNA sequence from the coronavirus spike protein into a viral particle, and then put that vaccine into your arm. So the J&J vaccine, the virus dumps its contents into your cells. The cells gets the DNA sequence from the spike protein and start to make mRNA, and then mRNA makes the spike proteins, and the next steps are the same. So the J&J vaccines takes it one step further than the other vaccines, but it's still the same concept. Your body is told how to make these spike proteins. Your body starts to make antibodies against them, and then once the virus particle from the J&J vaccine gets into your system and it's get used, it's also killed and tossed away. So your body does not have this particular virus in it. So it doesn't affect you one way or the other. Just the spike proteins are made to protect you. So if we compare the different vaccines and how they were tested, the Pfizer vaccine, they did their phase 3 study was amongst 43,000 persons across different countries. And you can see that they had a mostly white population in their study, less so Hispanics and less so African Americans. And there was a 51% females and 49% male. It was 51% male and in that particular study. In the Moderna population, it was 53% female, male in that particular study. And again, a lot more white persons than Hispanic than Black persons that were in that particular group. And for the Pfizer vaccine also looked at about 43,000 persons. And you can see the breakdown here. This had a lot more, again, white persons and less Black and brown persons as a part of their study group. So the study, this is how the participants have been selected, and this is how well we have data on so many different populations because of how they were chosen. Now, the J&J vaccine has been in the news a while because the FDA had issued a pause on this particular vaccine because it was found to be linked possibly to a syndrome called TTS, which is what it means, thrombosis, thrombocytopenia syndrome, in where your body makes clots. They thought that it could be secondary to the vaccine. So they paused it just to be on the safe side, and they looked at the data. So this particular syndrome, TTS, was, it had occurred in 15 women who have received the vaccine, and it occurred between 6 days and 13 days after the vaccine. And these women were between the ages of 18 and 55. So what they found is that the risk was about 7 per million if you're between 18 and 49, or it was 0.9 per million if you're above the age of 50. So the risk does decrease if you're above the age of 50. And the symptoms were like headache, visual changes, abdominal pain, nausea, vomiting, backache, shortness of breath. These were how these patients were presenting. So the CDC, let's take a pause, let's look at the data. They've then lifted that pause on Friday. They say, oh, you know what, we can still use the vaccine because it's very, very safe. However, let's just put a disclaimer in the information package that you give to your patients that there is a very rare risk of you getting this syndrome. So you should make an informed decision when you get the vaccine. So we still have 3 vaccines out there that we can use. Let's talk about variants. Now, viruses are living things. They, like us, like to multiply, but they cannot do so in the air. They have to be in somebody or an animal or something for them to multiply. And like everything else, when they multiply, there's a risk for errors to happen. And these errors are these variants that happen with the viruses are what is happening to us in the US right now. So the variants can either persist and live for a very long time, they can die off, or they can persist. So the most common variant that we have right now in the US is the B117 variant. That was first found in last year in the UK. That's the most common one we have now in the US that's circulating. The other one of concern was the B1351 variant. That was first found in the US this January past, and was first seen in South Africa, though, in 2020, December. The next one is the P1 variant. That was first found again in January of this year, but was first discovered in Brazil. And then there's the B1427 and B1429 variants that have been found in California. So these 5 variants are the ones that we are most concerned about. The good news is that the vaccines that we have available for coronavirus 19 still have shown to have some protection against these variants. So the best fight against these variants is to get your vaccine, because if you don't get the infection, the virus cannot stay in your body and mutate and form a variant. Now, why do we need a vaccine? So let's talk a bit about herd immunity. So herd immunity is when a large population of persons who are immune to a particular virus, they can then protect others around them from getting the infection, and they can become immune from getting the infection itself or getting the vaccine, and that's how they become immune. Now, persons may ask, well, Dr. Walker, why do I need to get the vaccine to become immune? Well, kind of just get COVID-19? Well, here's why. COVID-19 kills, the vaccine does not, right? So for you to get herd immunity by just getting infected, that would not make any sense because there's a risk of dying. The population in the US is about 330 million persons. For us to achieve herd immunity, we have to have at least 75% of persons in the US become immune by this infection, right? So that's about 247 million persons you will need to get infected for you to get herd immunity. Because the current rate of death from COVID is about 1.8%, you'd be killing off 4.5 million persons in the US just to achieve herd immunity by infection alone. It doesn't make any sense, right? So the best way to achieve herd immunity is vaccine, vaccine, and vaccine. The next graphic shows a perfect picture of what I mean by herd immunity. So this little guy here in the pink, he's infected with the coronavirus, and he passes it on to all these people who are in the blue because they are unvaccinated. So they get the infection because they're not protected. Now, if persons in the group become immune either by vaccine or infection, the green ones, then the blue ones are also protected, and you have less of the pink ones, because the infection has gone down significantly because they cannot pass around to anybody else because there's now some immunity. As more persons become immune, the green ones, they also protect persons who didn't get the vaccine because of herd immunity. So if the virus is suppressed from vaccine, it cannot pass on to someone, it cannot get or become a variant because it cannot replicate in your body. So this is why it's so important for us to get our vaccines, right? To protect ourselves and our friends around us. If you look at the symptoms of the vaccines, when I got my vaccine, I got like a sore arm, some redness, some swelling. But most persons will have a sore arm across the board. Other persons may have a tired, some achiness, some muscle pain, some chills, some fevers. But like I said, when this happens, the vaccine is doing its job, and that's what you really want to happen, right? And we cannot predict who will have what symptoms, and the symptoms may not happen after the first vaccine, may happen, occur after the second vaccine. So we're really not sure who will get what and when. Now, the CDC recently updated their masking guidelines for outdoors. The ones for indoors remain the same, but for outdoors, they've updated their guidelines to say that if you're fully vaccinated, and fully vaccinated means 14 days after your 2-shot vaccine series or after your 1-shot series. So 2 weeks must have passed after your last vaccine for you to become fully vaccinated. So that's what that means. So if you're fully vaccinated, you don't have to wear a mask outdoors in these scenarios, except if you're in a very crowded venue, a large outdoor venue, and there's no way you can socially distance yourself from somebody else, you should wear a mask. If you're unvaccinated, then it's kind of not so cool for you. They still recommend that you wear a mask in certain situations. If you're dining outside with friends and from several households, or if you're in a small group of people, some of them are vaccinated and some of them have not been vaccinated, you should wear a mask. Or if you're in a big event outdoors, you should wear a mask. So you see, if you get your vaccine, you have a lot less restrictions on your life than if you don't get your vaccine. Vaccines save lives. If you get your vaccine, or when you get your vaccine, you can also track or report your side effects through what is called a VSafe, which is a vaccine health tracker. It's from the CDC, and it's a smartphone-based app. You register for the app after you've gotten your first vaccine. It also tells you when to get your second vaccine if you're getting a 2-vaccine series, and you can input your side effects on the vaccine as they happen, and they log these side effects, and they can give you some data as to what's happening around you in general from the vaccines. When we started the vaccines in December, it was a phased basis. We're in phase 1. I got my vaccine like 4 days after it was given the EUA by the FDA. Now we're in phase 3. So everyone who's above the age of 16 is eligible to get the vaccine. So there's no reason why you should not get the vaccine. We've given more than half of the US population already at least one vaccine already. So we're doing a very good job. We still have a far way to go to achieve herd immunity, but you can do your part by getting the vaccine. This is just an app that can help you find a vaccine location around you. You can scan the QR code with your smartphone, and it tells you exactly where you can go to get a vaccine, or go to the website vaxfinder.mass.gov. We also have 2 clinics here at Baystate. There's one at Whitney Avenue, and that's the address right there, and there's one in Greenfield. That's open on Wednesday and Thursdays only. Again, you can scan the QR code to see how to make appointments or to go to these clinics. It's quite easy. We also have a clinic on a Sunday the 1st and Monday the 3rd, the 2nd and the 3rd of May. So Sunday and Monday, we have a J&J vaccine clinic. So that's a one-shot vaccine clinic. Again, it's available Sunday and Monday between 8 a.m. and 6 p.m. It's available to Hamden residents only, and you have to make an appointment before you show up for the vaccine. This is the QR code to scan your phone to see how to get this particular vaccine. And with each vaccine, it's a discussion between you and your primary care doctor to look at risk versus benefit before you get the vaccine. This is some other resources for that shows you how to get the vaccine. If you are a homebound person that cannot leave your house, there are some resources on the MassGov website that tells you how to get your vaccine, and some other locations how to get the vaccine. Again, it's all there. You can scan your QR code and to get these vaccine locations. So in summary, vaccines are that are available to treat to prevent coronavirus 19. They're safe, they're effective, they work. We are heading down on the curve right now because these vaccines are working quite well, which is why the CDC has changed its restrictions for persons who have become vaccinated. They work, get your vaccine. You still have to wear a mask if you're in certain situations outdoors, which I've spoken about on the last slide. But by and large, if you're in a household and you've all been vaccinated, and several households that are all been vaccinated, you can still have a small gathering inside, maskless, if you're all been vaccinated. There's a small chance that you can get sick and get COVID after you've gotten your vaccine. The vaccine efficacy is about 95%, so there's a small chance that you can get it. But if you do get the infection, it's going to be a very, very mild case. It will not end up in the ICU or the hospital because you will have some protection from the vaccine. All the vaccines that we have out there are very, very good, and they work very well. So some questions have been asked as well. How much does the vaccine cost? It is free to us because it was paid for by the federal government. They had funded the research. Can I get COVID from the vaccine? No. I explained to you about the two ways the vaccines are prepared. There's no live virus from the COVID in the vaccine at all. It just has some information of how to make a particular part of the protein, which is how the vaccine protects us. If you're undocumented and you want to get the vaccine, do you have to pay? No, it's free. What if I don't have an ID? Is it still possible to get the vaccine? Still free. Can I get deported if I go to get the vaccine and not have any papers? No, you cannot get deported. Do I have to get a test for COVID before I get the vaccine? No. If you have had COVID before, you can still go ahead and get the vaccine. Should I get the vaccine? Right, that's already answered. So, right, so that's the end of my my talk, because I want to get to some questions.
Great, thank you so much, Dr. Walker, for your informative presentation. Great information. We have now reached the Q&A portion of our program. I did want to introduce my colleague, Brittany Rosario, who will be assisting me with monitoring of the Q&A. So for those of you that are joining us by Zoom, again, please look to the bottom middle of your screen where you will see the Q&A icon. To submit a question, just click that icon, and then we will read the first name of the person in your question in the order that they are received. You do have the option to remain anonymous, so if you would like to do so, just check anonymous when you submit your question. And we do have a couple questions that were submitted in advance, so we'll try to include those as well. So all the questions will be posed to Dr. Walker, and he will do the best of his ability to answer your questions. So with that, let's open up our Q&A. So Brittany, would you like to read Dr. Walker one of the first questions?
Sure. This came from an anonymous attendee. If you tested positive on March 17th, is it safe to get the vaccine now? Why was the initial recommendation of 90 days?
Okay, so the 90 days came when we were back in the pandemic in the earlier days. We weren't sure how long you had some immunity from the getting the vaccine, the infection, if you had, how long the antibodies last in your system from getting the infection. So they thought that 3 months was a good time for you to wait, but now they have more information and you don't have to wait that long. So if it was March the 17th and you've been well beyond your date for isolation, and you have no other symptoms, then yes, you can get the vaccine. Absolutely.
And a couple of follow-ups to that related, and Anna Marie, if I could just add on to it. So same person was wondering, is the reaction more intense if you've recently had COVID? The reaction to the vaccine, especially if someone had COVID pneumonia or fever when they were first diagnosed?
Anecdotally, that has not been the case. Persons will have symptoms and side effects, but from what I hear, the COVID infection is a lot worse than the symptoms or side effects from the vaccine.
Great. Our next question is anonymous. Based on the definition of the word vaccine, would the Pfizer, Moderna, and J&J vaccines be qualified to be called gene therapy?
Great question. So no, that's the short answer. So gene therapy uses genes, DNA, to fix a broken gene for a disease process. Some diseases are caused from genes that aren't working properly. So gene therapy serves to fix these genes to make the disease better, which is not the same thing as COVID vaccine, as I explained how the two vaccines work. So no, it's not the same thing.
Thank you.
Thanks. Next question we have here, also from an anonymous attendee. How long does the vaccine immunity last?
So studies are still ongoing for that. And this is why Pfizer and Moderna are thinking about giving us a booster shot in the fall, because they're still not sure how long we have antibodies against the virus. So studies are still ongoing. But we may need a booster, I think, from what the CDC is saying.
Thank you.
Our next question is anonymous. Can I still spread COVID if I'm vaccinated?
So that's a great question. So the data on that is not very strong that you can spread COVID. You can still get infected, like I said, because there's a very small chance. But because the vaccine is so powerful, we're not sure if you can spread it. The data is showing less and less that you cannot spread it if you've gotten the vaccine. So it's getting more and more sure that you probably cannot spread it if you get the vaccine.
Great. And then Dr. Walker, we have a special guest with our attendee with us by the name of Carmelo Stewart. And I happen to know Carmelo is a first grader and is very interested in science.
Okay.
And has a desire to go into science for a career. So his first question is, why does Johnson & Johnson only require one-shot vaccination? Some people in my community are concerned with so many versions and storage of the shot.
So the Johnson & Johnson vaccine has some advantages, like you just mentioned. It's a single shot vaccine, and it can be stored in a regular refrigerator. So that makes it more accessible for persons that are living in like the hill towns and they can't afford these very expensive deep freezers to keep the vaccine in. So it makes it more sense for certain populations to get the vaccine. Also, if you think about it, some persons who are probably homeless, who may not come back for their second shot, it's a very good vaccine for them. Or some persons who or you can use this vaccine as a traveling vaccine. You can just go from town to vaccinate people and move on. How this particular vaccine was developed, the antibody response to that particular vaccine is just as good as the other two vaccines. So that's why a booster was not thought to be needed. But there are some advantages to that J&J vaccine.
Great, thank you. And Carmelo had one other follow-up question. He would like to know if there are good viruses.
Of course, there are good viruses. There are good viruses that help to protect us, and there are bad viruses. Like everything in life, there's good and there's bad. Because for some of the coronaviruses, they're not as deadly as COVID-19. There's some that cause a mild cold, and you get a cold, you move on. There's nothing deadly about those coronaviruses. So yes, there are.
Great. Next question comes from an anonymous attendee. Is there anything I can do before getting the vaccine to minimize side effects?
So and that's a great question. They do not recommend that you take anything like Tylenol or ibuprofen or anything before the vaccine. We're not sure how that will affect the immune response. What the CDC has recommended, though, is after the vaccine, if you have these symptoms and they're very, very worrisome, you have a severely sore arm, a very high fever, shaking, chills, you can go ahead and take something after the vaccine, but not before.
Thanks for that clarification.
Our next question is from an anonymous attendee. Are certain groups of people more likely to have side effects?
Yeah, so everybody's unique. And like I said before, it's difficult to pinpoint who will have what side effect. Even persons who are known to have serious vaccine side effects to other vaccines have not been shown to have serious vaccine side effects to the COVID-19 vaccine. And it's on a case-by-case basis. It's hard to say who will have what. But by and large, the symptoms are mostly mild, and within 24 hours, you get over them.
Next question in the queue is, how do we know we can trust the information about the vaccines?
Well, like I said, all the steps were followed through with each step of the vaccine, just like other vaccines are doing, have gone. And so the data is clear. We've had roughly, a few months of us getting the jab in my arm. I got my jab in December and I'm still walking around quite fine, no issues with me. And the study participants between the three vaccines had over 120,000 participants across the three vaccines that we have approved in the US. Plus, there are other vaccines that are in other countries that have been tested. So I think the data is clear. The vaccines are quite effective. They work. And I must admit, as a physician and as a human being, I had my reservations as well. But I read the science and I looked at the data and I was like, if I have a chance to save my life, protect myself, my loved ones, my friends, and my patients, why not take a chance and get the vaccine? And when I got the first shot, I did have some side effects a couple of hours later. I had a sore arm, I felt fatigued. But after that, I felt like $1,000,000. I felt like I was doing my part to protect myself and to protect everybody else around me. So I think you get this altruistic idea and feeling after you want your vaccine because you're doing the best you can to protect yourself. So I think you should trust the science, trust the facts, and get the vax.
Thank you.
Our next question is from Janet. They say the vaccines are only a certain % effective.
Mm-hmm.
Is there a way to know if you are the 1 in 20? or is it that it may not be 1 in 20 or whatever it is that may not be affected from the virus?
That's a great question. So the sure way of knowing is that you'll get infected, right? That's the sure way of knowing if it wasn't effective. But let me give you some perspective, Janet. Think about the flu vaccine. Every year we get the flu vaccine, right? The flu vaccine in a good year is about 45% effective. That really, really sucks, 45%. We have these two vaccines from J&J and Mrna, 95%, and for the J&J vaccine up to 66%. And it gets higher for persons to prevent hospitalizations. It's a pretty awesome number, right? So I would take my chance and get the vaccine and see if I get infected after COVID. I mean, post the vaccine, cannot get the vaccine. And if you think about it, COVID is so much worse than a sore arm or a fever from the vaccine.
Thank you. Next question is, can the vaccines change my DNA? Are there potential long-term effects that we don't know yet about?
That's a very good question. And that's a very popular question that I've had. So like I showed you before, the two vaccines used two different ways to get information into your cell to make that spike protein. In both scenarios, the body kills and discards that particular vehicle that get the material into the cell. So there's no way it's going to affect your DNA. And it's even safe for pregnant women. So that's how safe the vaccine is. So they are a very special population, right? So if you can give it to someone who's pregnant, it is pretty safe.
Thank you. Carmelo has another question. He would like to know, and this is actually a question I had too when I was doing my research, how long do we anticipate this vaccine lasting, and will we have to keep getting it similar to like the flu shot?
So that was a question that we spoke about earlier. So we're still unsure how long the antibodies last against the vaccine when we're vaccinated. But and like I said, two companies, the Moderna and Pfizer, are looking into giving us a booster in the fall because we may have waning immunity. Like most vaccines, there's a time span on most vaccines, right? So like the flu vaccine is given every year. This may or may not become a yearly vaccine. We're not sure yet, but I think we will definitely need to get a booster at some point. We're still not sure how long the protection lasts.
Thank you. Next question here. It's a very simple one. What does each different vaccine do?
They all protect us from coronavirus 19, but the way the vaccines are manufactured is a bit different. But they all have the same end result. They get the body to make these little spike proteins on top of the virus that then the body then recognizes and form antibodies again. So when they get the real thing, if you're exposed to the real virus, the body can just attack it, kill it, and you don't get infected from it. So they all have the same end game to protect you from getting the coronavirus.
Thank you. I do want to just give another plug that please submit questions via the Q&A icon at the bottom of your screen. Your questions that have been coming in have been excellent, so please keep them coming. We have time for a few more. I also wanted to just ask Brendan to pull back up the poll questions that you asked earlier, Dr. Walker.
Yep.
I think just given your presentation and some of the questions, it would be good just to look at those again, just to see. Oh, wrong poll. We'll give while we do that, we'll look at that while we have a few more questions come in. So it looks like the first question, the coronavirus is expected to mutate. Everyone answered true, and that was the correct answer.
Correct.
But the second question, not everyone got it correct. So I was wondering if you could speak to that one a little bit more.
So the data is clear that persons that are Black or brown are more adversely affected or infected and hospitalized and have died from COVID than our white counterparts. The data is clear, so the answer is true. And it's thought to be due to several different factors why Black and brown persons are more infected. It may be something like because of where they live, there's socio-economic circumstances, poverty level, access to healthcare. Some of these persons have more diseases like diabetes or hypertension. So it's a mixed bag of why Black and brown persons are more adversely infected and are more likely to die from the particular infection.
Thank you. And the next question was, you can stop wearing a mask in public after you're fully vaccinated. Everyone got that right. And then the final question,
except in a crowded area like a football game or somewhere where you cannot achieve social distancing and you're still required to wear a mask.
Yep. And then the final question was, the COVID vaccines do not undergo the same steps as other vaccines. And I know you shared this in your presentation, but maybe you could just elaborate on that just a little bit more for folks.
Absolutely. So vaccines can take a very, very, very long time. And there's a very expensive process to make a vaccine. So the technology that we use for the Pfizer and the Moderna vaccine from the particular vaccine has been around. The way to make the vaccine has been around for decades. They've been trying to get these viruses, like Zika virus, for instance. They tried to make a vaccine for that particular virus years ago using the same mRNA technology, but they just couldn't figure out how to get that particular particle safe enough to get inside the body. So they've been practicing years and years and years for this. And then when this pandemic happened, they're like, okay, let's increase our research, and they actually figured it out. This is first of its kind of a vaccine. No corners were cut. Every single step was followed. And the truth is, if they didn't start to manufacture the vaccine at the same time as the testing was being done, we would not have gotten those jabs in our arms 4 days after it was first given the green light by the FDA and the CDC. I'm glad that they actually did that, because within months and months for them to start making the vaccine. So I think that those two steps being done at the same time was a big plug and a great way for us to become protected.
Thank you. Brittany, would you like to read the next question?
Sure. Next one here is, are there any groups of people that should not get vaccinated? And are different vaccines more effective / safer for different people?
So, okay. So I've been thinking about this myself too. And if someone comes to me and they have an option to get one or the other vaccine, and they're a young female patient who, as you can see from what I presented earlier, the risk of this TTS is higher in persons who are between the age of 18 and 48 years old. It's about 7 per million. If you had a choice to get the Pfizer vaccine or the Moderna vaccine or the J&J, I would say probably get one of the 2-shot series as opposed to the single-shot series. So that's it. It's a risk-benefit thing. If you have a choice, I would say go with one that has less risk than the other. Okay, that's how I would inform my patients. And let them make the decision themselves to see which they think is a better one for them through informed decision making. If you've had a severe reaction to the one vaccine, you should not get a second vaccine in the series. If it's a 2-shot series, you should go to the other brand of type of vaccine. So for instance, if you had Pfizer and you had severe rash or anaphylaxis, you should not get a second dose. They recommend you try to get the J&J vaccine instead, which is a different vaccine altogether that is not likely to cause the same reaction. So those kind of persons should get a different vaccine, or those are reasons why you shouldn't get the same vaccine. If you're immunocompromised from HIV, if you're on somebody with cancer chemotherapy, if you have lupus or whatever, you can still get the vaccine. Everybody should still get the vaccine. It has no eggs in it, so if you had a problem with eggs before, it doesn't have any egg, you can still get your vaccine. So by and large, there's not anybody who should not get the vaccine unless they've had a reaction to the first vaccine.
Great, thank you. I was not aware of that, so that's really helpful to know. Our next question is from Carmelo. He would like to know how safe the vaccine trials are how they're going for children. His pediatrician says he should get the vaccine, but he's scared.
Yeah, so I haven't seen the data yet for children myself, so I really can't speak to that, Carmelo, but that's a very good question. But I suspect that we'll have some data soon in children.
Awesome. So we need to stay tuned.
Stay tuned.
Next question here is, I work in downtown Springfield. With the new guidance for safety outdoors, should I still be wearing a mask when walking down Main Street?
Well, if you're fully vaccinated, then, and it's 2 weeks post, then if you can assure that that someone will not walk up to your face and say, hi, and spread it, you know what I mean? Then sure, don't wear a mask outside if you're outside, if you're fully vaccinated. But if you aren't sure that you'll be able to, to be safe away from somebody, then, it's probably a good idea to wear a mask, especially if it's not 2 weeks post. But by and large, it should be safe outside to walk around wearing a mask. Maskless in downtown Springfield, because it's a big open area, so it should be fine.
Well, thank you. Well, that has completed all the questions that were in our queue, and we're getting to the end of our time. So I'd like to, again, extend our sincere appreciation to you, Dr. Walker, for joining us today, your expertise and your informative presentation. Thank you to all of our participants for your interest in joining us today and all your thoughtful questions. Really, really great questions tonight. I learned a lot of new things tonight as well, so thank you. We know you may still continue to have questions after this evening and encourage you to visit our website, www.baystatehealth.org/bestshot to continue to learn more. At Baystate Health, we're committed to providing comprehensive care and delivering on our promise of advancing care and enhancing lives to all those we are privileged to serve. We thank you again for being with us this evening and wish you a good night. Thank you.